Hei, hyggelig å se dere. Marianne Njøten heter jeg, og har gleden av å ønske dere velkommen til BI. Det er ikke så ofte vi er her, men det er hyggelig å kunne besøke denne utdanningsinstitusjonen også. Noen praktiske opplysninger først. Kaffe og te og litt mat har dere funnet ute. Vi skal også ha en pause etterpå, hvor det blir litt frukt og litt mer kaffe og te hvis det skulle være ønskelig. Toaletter er opp trappen, utenfor der hvor vi hadde mat og drikke nå. Opp der, på begge sider, er det toaletter. Og så stenges disse sidedørene som er i området her, disse runddelene, de stenges nå klokka 6, så da er det bare hovedingangen som man kan komme ut inn. Og det er ved siden av trappa, altså rett ut. Ja. Og så tilbake til seminaret. Det vil foregå på engelsk. Wow. Neida, det går bra. This seminar is about Brachycephalic obstructive airway syndrome and was initiated in dialogue with our breed clubs and NKK's Brachycephal Råd. The Cambridge University and the Kennel Club in the UK has done some exciting cooperation in this area, and we are excited to hear about it. And we are very pleased to have senior lecturer in small animal surgery and head of Cambridge BOAS research team, Mrs. Jane Ladlow, here today. We are very excited to learn more about your experience in BOAS and the work you have done in cooperation with the Kennel Club. And this is only started, so it is on its way, I believe. Jane will give a lecture for 1.5 hours.
But you can get up in the middle, you can walk, we can have a toilet break when you need it. Fine, okay?
Yeah, you can. But you will miss something, I guess. And this first part, it will be streamed by Agria Dyreforsikring. And only this first part. And we are very happy about that too. And after that, we will have a break for half an hour with some coffee and some fruit. And after that, we will have some questions and answers if you have some. You are welcome to give questions to Jane about her area, her field, and everything she knows about. And she will try to answer you as good as she can. If you would like to ask your question in Norwegian, you may do so. And Maria will try to translate, and we will do the best we can with that. If not, you can also give us the questions in the break to Maria or Cecilia in the first row, and we will write it down, and we can have Jane to answer for them afterwards. And please note that we will only have questions for Jane today, not about what the Kennel Club will do, that we will come back to later. We will make an article from this seminar, and we will work on it. We find it exciting and necessary to work on. So, finally, once again, welcome Jane.
Thank you.
We are happy that you are here, and we are excited to hear what you have to say.
Thank you very much, and thank you very much for coming out to listen to me. Just kind of explain how this all started. I'm a soft tissue surgeon, so I'm a practicing vet. My real interest is soft tissue surgery. I did some exams a few years ago, about 16 years ago now, that are board exams, and then you become a specialist in your area. And after I did my board exams, I was all keen about my surgery, and I was looking at some of my bulldogs and thinking, this is interesting because you're not quite doing what the papers say. So I was looking at bulldogs, having operated on them, and I wasn't sure they were any better. And yet if you look at the papers and all the veterinary literature, it says they all do brilliantly after surgery. And I was thinking, well, how is that? And actually, when you go back and read all the papers, it's all just on telephone calls. Nobody actually looked at the dogs. And I wasn't convinced by the patients I was seeing, being young and female, that actually what was happening was what was meant to be happening. So I thought, well, what I'll do is I'll start measuring the respiratory function in these dogs. That was 16 years ago, okay? 16 years. It took us about 10 years to work out how to measure respiratory function in these dogs, and I think we have some nice ways of doing it now. The reason this research has worked is because I had a very, very good student with me, a PhD student, which meant that while I was operating and being a vet, she could actually be in the lab and doing the research. And that's why we've come out with decent results, I think. So most of my work has been done with Njøten, and we work very much as a team. If I say anything that you don't understand, please put your hand up and interrupt, because if you don't understand, other people will not understand too. I don't like being heckled. No heckling, no booing, just comments and hands up, right? So I was going to start off with an introduction to BOAS, the Brachycephalic obstructive airway syndrome, as far as I know it. And then I thought I'd talk a little bit on how we recognize it or diagnose it. And then we're going to go on to the respiratory functional grading scheme that we have introduced in the UK recently. And then what else can we do as far as Kennel Club measures and veterinary measures to help control some of the more unhealthy dogs we are seeing in some of these breeds. I'm not sure we'll get on to management today. Now, one thing I'd like to say as well is it is true that I have totally focused on BOAS because that's my area, but the whole issue with brachycephalics is wider than just the airway, and there are other issues too. So when I talk about BOAS, I'm thinking usually about the respiratory, the breathing problems, also the exercise intolerance, the heat intolerance, sleeping disorders, which is something that we're recognizing a lot more of now, but was probably missed in the past 20, 30 years. And then regurgitation is usually linked to airway as well, particularly in the extreme breeds. So regurgitation to me comes under airway. Now, other things that happen with these guys that I'm sure you're aware of are eye problems, neurological problems, so discs, and then there can be some episodes of dystocia, although there are lines that also self-whelp, okay? So there's a bit of a mixture there. And then we can have hemivertebra and screw tails. Now, what is interesting to me, and we haven't sorted this out yet, is if you have a dog that is severely affected by BOAS, does it also tend to get the other conditions as well? Which, if you flip it, if you have a dog that is not affected by BOAS, is it likely to be a healthier dog generally? Okay. So we have a cohort of grade 0 dogs, so completely unaffected by BOAS, and we're going to follow those and see what other diseases they come up with, because it would be nice if you think if I have a healthy dog here, it's likely to be a healthy dog in other areas. We've got some preliminary research which suggests in pugs, if you have a dog that's severely affected with BOAS, they are more likely to get eye problems. So in the pug, it looks like the two are linked, okay? And if it is, then maybe that gives us a better way going forward as well. Now, what is the problem with this brachycephalic syndrome? Well, there's a few things. A, we know it decreases lifespan, okay? So on average, the brachycephalics live 3 to 4 years shorter than dogs that are equivalent sizes or weights. Now, to be honest, I don't really care about that, okay? That doesn't bother me too much. What bothers me is the morbidity, okay? So some of the diseases we talk about, particularly the respiratory obstruction, are quite distressing. They present at a relatively young age, so 2 to 3 years of age, and they are progressive. So if a dog gets it, it's going to live with it for 6 or 7 years, okay? And that, to me, is the issue. So mortality, okay, but morbidity is the issue, I think. You know, dogs are suffering lifelong in some cases, and people do not recognize that their dogs have got an issue. So that's what I don't like. Now, I'm also going to be completely honest and say that we have looked at the extreme brachycephalics, the pugs, the French bulldogs, and the bulldogs. Because in the UK, we've got a huge number of these dogs around, so particularly the French bulldogs, where I think we registered 15,000 last year, and they are now the most popular breed in the UK. Okay? And the pugs are going up really fast behind them. The bulldogs are still going up. Okay, so actually, I missed out a graph at the beginning. They're going to hate me on the streaming things. If we look at this, this basically shows you the increased rate of demand for these different breeds in the UK. So we think we've got about 350 to 400,000 French bulldogs in the UK at the moment. We may have more, okay? So we focused on those 3 breeds because, to me, these are the extreme brachycephalic breeds, and they are the most popular breeds. And I also think they have the worst airway disease. But we have to be very careful because people talk about brachycephalics, and that covers a huge number of other breeds. So these are Afghan pinchers, okay? Playing on the beach. They're great as far as their breathing goes, okay? So I can't tell you yet what kind of airway disease the Afghan pinchers have got. Okay? And I've been to a few Afghan pincher shows because they want me there. And I listen to them and I think, is that the worst you've got? You know, that's where we are with the Affenpinchers. Shih Tzus, I'm not convinced Shih Tzus have much apart from nostrils. Same with Japanese chins, okay? So, and even the peaks I've seen have not been anywhere near the pugs, bulldogs, and Frenchies. So I like to define very clearly which breeds I know about, and I know about pugs, Frenchies, and bulldogs. I know a little bit about the other breeds, but as far as I am concerned, we have not worked out how important airway disease is in the other breeds, or particularly the prevalence of airway disease in the other breeds. You know, I just want to say that. So when we have a thing in the UK about ban the brackies, and I think, well, which brackies do you want to ban? You know, Shih Tzus, Japanese chins, Affenpinchers, what are we talking about? Okay, so I am just talking about today the pugs, the Frenchies, and the bulldogs, because that's what I know about. So when you step back and take a look at this, you think, well, what are we going to do about this? So we've come up with some very nice ways of measuring disease, okay? But how are we going to use them? Well, we can improve the health of the current population with them, okay? And we can hopefully improve the health of the future generations with them now by advising on breeding. So that's where we're going with this. So if we just go back to BOAS now and just talk a little bit about it. So Brachycephalic is short head, okay? But these breeds are quite different. So this is your typical pug, but the pug looks very different if you look at the CT to the bulldog and the French bulldog. So although we talk about the brachycephalic obstructive airway syndrome, in the different breeds it is different, okay? And that's quite important. So it's different in each breed. Now, what happens with these guys is that we think that the bones shrink, and particularly the bones of the muzzle, so they've got a short nose, but you don't always get corresponding reduction in some of the soft tissues within the head, okay? So effectively what we're talking about is a meat-in-the-box principle here, where you've got the skull being the box, so the skull is the box, and then the soft tissues are within inside the box, and if you shorten and make that box smaller, sometimes we're still squashing all the same amount of tissue in there, and the white bit is the air, and that's the bit that's restricted, okay? So by putting all that soft tissue in a much smaller place, then we are restricting the breathing spaces, the air spaces in some of these guys. So if we look at a typical French bulldog that has BOAS, okay, there's certain lesion sites. The first one is often the nostrils. So the nostrils will usually be stenotic in our affected dogs, not always, but usually, okay? And then if we go further back, behind the nostrils there is excessive tissue in that nasal cavity. And this is what we call the turbinates. And you can hear this actually. When we come on to some of the sounds, you'll be able to spot the nasal dogs by listening to them, okay? Behind that, we've got this really thickened and long, soft palate. Now, interestingly, what we don't know is whether that soft palate is thickened because of obstruction in front of it. So does the nasal cavity obstruction come first, and does then the palate thicken? Okay, so we haven't worked that out yet, but it is thick and long. And then the other thing that these guys sometimes have is a very elongated and thickened tongue base, so this macroglossia. And I think some of the pugs are the most obvious with that, where they don't put the tongues back in their mouth and you can see them and you think, that's interesting, okay, you really can't do that. Now behind that we've got the larynx, or the voice box, and the larynx, if you leave it long enough with obstruction further up, then the larynx will start to collapse. It's like a hose pipe. If you're sucking through it the whole time, the edges of the hose pipe will collapse, okay? So the larynx is the area that tends to get the collapsing. And then behind the larynx we've got the windpipe of the trachea, which is interesting because this is often quite small. It's called hyperplastic, particularly in some of the bulldogs, okay? And that probably does affect the upper airway. Now, it's important to remember with dogs that dogs are obligate nasal breathers, okay? So they want to breathe through their nose. And during the day or when they're exercising, they can overcome this by panting or opening their mouth. But at night, they will struggle, okay? So if you ever have a dog that is searching to put its head up or resting its head up at night when it's sleeping, or a dog that frequently disturbs, or the best one yet is a dog that puts a toy in its mouth when it's sleeping. Very clever dog, that one. What they're trying to do is keep their oral pathways open so that they can sleep and breathe, okay? So the sleeping is becoming more important these days, I think, as we're looking for it, basically. Now, if we go and start at the nostrils, there's a few things to look at the dog's nostrils, okay? So we look at the outside of the nostril, or the cartilage that we can see, but inside, about 0.5 centimetre inside, there's another bit of the nostril called the alar fold, which we call the second stenosis. So the nostril isn't just a bit you can see, there's a thickened bit inside that as well. Now, we started looking at the nostrils quite early on because in some of our guys, the nostrils are really, really closed, okay? So these are brachycephalic nostrils, and we have grading systems for the pug, the French bulldog, and the bulldog because they're a little bit different, okay? So if you look at our website, we've got grading system for all of the 3 breeds. Now, it's important to remember with the nostrils that the bit that's important is the top bit, the dorsal bit. So the air flows dorsally, okay? So the bit at the bottom that sometimes people say, oh, look how open my nostril is, that's blind ending, okay? So the ventral bit at the bottom is a blind ending pouch, not important. It's the dorsal bit that's important, that slit at the top, okay? Now, we called open and mild acceptable for brachycephalics, okay? Maybe not perfect, but acceptable, okay? When cartilage is touching the medium philtrum, okay? So we're not happy with those. And when there's severe stenosis, there's barely any gap at all, okay? So we are saying open and mild is okay, and moderate and severe we don't like. Now, the other thing that's important to do is to look at some of these guys when they are actually exercising or excited and see, does the nostril move, okay? This is a French bulldog. His nostrils are beautiful, right? So he's got open nostrils, and they are moving really well. Okay, so that's I wouldn't touch that nostril. That is a beautiful nostril for a French bulldog, and it's got motion. Okay, we see these as well. Very nasal noise, very narrowed nostrils, and you can see the skin sucking in behind the nostrils, and there's no mobility at all. Okay, so that nostril cannot do anything. Okay, so it's not just how the nostrils are looking when the animal is static; it's also whether they open. Whether the animal is when the animal's exercising. Now, if you look a little bit further back at the nasal cavity area, this is where we come to the turbinates. And Professor Ochtring in Leipzig has done a lot of very good work on these turbinates. And you can recognize, I think, dogs that have got excessive turbinates because they mouth breathe excessively. Okay? They're also heat intolerant. So heat intolerance, okay? And these guys as well, when you take them out for a run or a trot, they switch to mouth breathing almost instantly, okay? And sometimes they'll sound much better when they're opening the mouth because of the obstructed bits in the nose. So you think, well, actually it's better, but it's not better. It's just the dog's found a way to get around the obstruction, okay? So you can recognize these guys. They also tend to be the ones that if it's a tall warm, they'll splay themselves out. They're sensible. They're trying to lose some of their heat. So the way dogs lose heat is that they pass air through. Actually, they take it through their mouths and pass it back out over their turbinates. And it's those turbinates have got a nice layer of mucosa over them that cools them down. But if they don't have nasal flow, they cannot cool down, okay? So if you've got an obstructed nose, those dogs will not be able to cool themselves efficiently. Now, if we go a little bit further back, we're in the back of the throat, the pharyngeal area, and this is where we've got the long, soft palates. And the problem with the long, soft palates is they get sucked into the epiglottis, okay? And that, unfortunately, can result in quite marked obstruction and a very noticeable stertorous vibrating noise. Now, one thing I just want to say about the palate is that we see a lot of dogs that come in and people have trimmed palates, right? Well, if you look at, this is a German Shepherd dog, and his palate is overlapping his epiglottis, and that's normal. And the same thing happens in Cockers and Springers and Labradors, okay? So it is completely normal to have a palate that overlaps an epiglottis. So unless you've got clinical signs that directly link to the pharyngeal area, then I don't trim them, okay? So I need to know that my clinical signs are coming from this area before I trim them. Now, in some of our guys, it's a couple of centimetres, and you think, fair enough, but we see a lot, particularly of Cavalier King Charles dogs that come in and have had the palates trimmed, and actually their obstruction is in the nose. And you think, well, it won't have done you any harm, but it's not done you any good either, okay? So just be wary of palates. Now, I think it can be very difficult to work out, really, in our guys, from the outside, what is a good dog and what is a bad dog, okay? And partly this is because you can have dogs that look almost identical from the outside, okay? Almost identical, and yet one will be severely affected, like the guy on the left-hand side here, and the other one has got the most beautiful palate I've ever seen in a Frenchie, okay? So almost identical in their appearance and very, very different in their airway. I will talk about that. It's a really good question. Okay, maybe we'd come to that in the questions afterwards, right? Because that's a very good question. It's a good question. Good. Okay. So this is a beautiful palate in a French bulldog. Now, I've spent a lot of time looking at these CTs, and we're about to put another paper out that looks at the difference that you have between affected and non-affected dogs as far as CT goes. The only thing that hits me here, and I don't know what you guys think is, but to me the stop is a little bit more gradual on the right-hand side than the left-hand side. Okay, so the stop is a bit between the eyes, and I think that's probably what I'd be looking at, yeah. So the bit that people go on about is the nasal length, right? But the nasal length, oh, thank you. Oh, thank you. Right, so this is a stop here, right? Okay, and that to me, this stop is slightly better than this stop, okay? Now this is what people are talking about when they talk about the nasal length, but to me, this has just got the nostrils in it. So if you make this bit longer, you might not help the nasal cavity at all, okay? So we do have to be careful about how we talk about how we're going to improve these dogs, because it is not straightforward. Okay. Now, how do we recognize these oversized soft palates? Well, it's a typical bulldog noise, okay? So it's a low-pitched vibrating noise. And often these dogs, when they get a little bit excited and things swell up, they can't swallow and breathe at the same time. So if they're getting a little bit distressed, what they'll tend to do is walk a little bit, and then they'll produce a load of saliva, which they usually land on your shoes, okay? So it's the big guys that cannot swallow and breathe at the same time, okay? So then moving a little bit further back from the palate, we're now in the larynx. And the larynx is a particular pug issue, okay? So what you find is the French bulldog and the bulldog have got quite rigid cartilage, and their larynx takes an awful lot to deform, but the pug's got quite a soft cartilage. And you will find in pugs you can get a dynamic laryngeal collapse, okay? And we've reflected this in the grading system. So this is not paralysis, this is inspiration. Inspiration, okay? This larynx can move, it's just excess forces stopping it opening, okay? So this is just excess force stopping this larynx doing what it should be doing. Now, unfortunately, if the larynx gets too much pressure, too much inspiratory negative pressure, you've got these little tissue kind of bags at the bottom of the larynx, just in front of the vocal folds, that are called saccules. And these saccules pop out. So if you've had a dog that's been stable for quite a long time and then suddenly has an acute episode and then is never the same again, it's probably these things, okay? So these are saccules, and once they're out, they do not go back in. Now, the problem is from this kind of dynamic collapse, you can go on to have complete deformation of the larynx. So you can then get complete collapse of the cartilages, and this will cause issues, and it can be difficult to get the dogs back from this. Poor prognosis. Now, the other thing that we will sometimes see is the tracheal hyperplasia. And generally what we're seeing with the tracheal hyperplasia, it's in the little bulldog puppies. And they often will present to us at 3 to 4 months of age. And we tend to be really hands-off on these dogs. So what we usually do is do fluoroscopy or radiographs without sedating them. And you clock the fact they've got a tiny trachea, and we'll nurse them through aspiration pneumonia. And if we pull those dogs back in when they're mature, they usually don't need surgery, okay? So with these dogs, it really is that tracheal hyperplasia. And if you get them through that, then you can be all right. And I smiled at this because the veterinary literature from the 1960s, 70s was written by a guy called Colin Harvey, and he's the father of all ENT literature in the veterinary science. But again, it was very observational when they were looking at these dogs. And he said tracheal hyperplasia doesn't matter, right? And the breeders have been telling me for years that tracheal hyperplasia does matter. And guess what's coming out is really important on bulldogs in our data, trachea, right? So you think actually, you know, the relationship between the breeders and the research is actually a two-way relationship, and I actually get a lot of useful information from them. I giggled when I saw that. They're going to like that one, okay? Now, unfortunately, we then get secondary changes with BOAS, and we can get gastrointestinal disorders, and this can be reflux, or if it's really unfortunate, then you get these hiatal hernias. And this is a dog that's been given contrast down its esophagus. This is the esophagus here. These folds here are the stomach folds, and this stomach is in the chest. And what happens here is the dog takes a breath in, and because there's so much pressure up here, you've got excessive inspiratory pressures in your chest, and the stomach is pulled up, okay? And so this is dynamic. The stomach can slide in and out again. But certainly if you've got an animal that's struggling and it's got a big hiatal hernia, it puts pressure on the lungs and everything gets worse. Now, disease recognition is important. And what can we do? Well, we can look for subjective signs. So for years we looked at clinical signs. And you did this at an animal veterinary examination usually. Now, the problem with this is when I started all this off, I went back to the textbooks and tried to work out what people were saying, and everyone just talked about noisy breathing. Well, somebody's noisy breathing is somebody else's completely normal, okay? So the descriptions of clinical signs are usually very, very vague, and that creates issues because then you have two vets calling the same dog something completely different, okay? And that creates problems for breeders and for owners. So we came up with an objective test, so the respiratory function test, and then from that we've also got the functional grading, which I'll talk about. So these are the clinical signs we're talking about. I would call that nasopharyngeal, okay? So there's a big nasal component in there, but there's also a palate vibrating there as well. Now, the problem we have, particularly in the UK, is that a lot of people will call this normal, okay? So lots of people will say that's completely normal for a pug, and I think, well, I don't want to sound like that, okay? And for every dog that you show me like that, I can show you a dog that sounds way better, okay? So it shouldn't be normal for a pug, okay? And if you talk to some of the vets, they will and the vets are exactly the same, okay? So it's not just the owners, the vets have got used to it as well, which is a problem for me. But they will tolerate things from pugs and French bulldogs that if it was a Labrador, you'd trach it. You know, you'd be thinking, oh my goodness, there's a mass here, you know, you'd rush out there, okay? So there is a general tolerance of these noises which should not be acceptable. And unfortunately, we find with our owners, about 60% of owners do not recognize clinical signs of BOAS. And we have this great questionnaire where we go through everything and we say, can your dog exercise? You know, does your dog sound noisy? And at the end, we've got this one question that says, does your dog have airway disease? And loads of people will tick, you know, yes, it can't exercise, it's noisy, and then they will still say, my dog does not have airway disease. And you think, well, what do you think it's got, you know? So even when they can tick what it's got, they will not always link it to having airway disease, and that's an issue. Now, the bulldogs are a little bit easier. Because I think the affected bulldogs are easier to spot, okay? This is interesting. When I started off, I thought the bulldogs were the worst of the three breeds, because often the ones you see in the vets are the most affected, okay? It turns out that the bulldogs are the best of the three breeds in the UK, okay? And moving very fast to having a very good population, which is lovely, okay? The worst are the pugs, okay? And I didn't see that because an affected pug is not as obvious as an affected bulldog. No, it's interesting, right? You also get some more subtle clinical signs. So we're seeing more of these guys now. So look at the rib cage. Okay, when this dog's trying to sleep, the rib cage is moving. He's desperately trying to sleep. And the problem is these fly all over Facebook now, and people video them, and it's funny, and it's, you know, oh, look at my dog, and they're everywhere, and they're all sleep disorders. And you see pictures of dogs sitting up. We have dogs that come into the consult room, and they're falling asleep on their feet. I've got videos of dogs sleeping on their feet, you know, and you think, oh, you know, this is a problem. But people, again, particularly public, will generally just think, oh, it's funny and it's cute, and it's not funny and it's not cute, okay? This is another one we've seen. And this is often put down to dogs eating quickly. Well, my dog eats quickly, and he doesn't do this, okay? So there's a lot of things that are happening because of this condition that people are tolerating, okay? So how did we initially define this? Well, what we did is we got a load of decent dogs, actually. So we went and we worked at the dog shows, and we had some very, very tolerant breeders who let us box their dogs. So this is our dog box. And we were very lucky that we started off with the show dogs, because the show dogs are used to being crated, and therefore we could get results in most show dogs within 10 minutes, okay? Our tolerance of this test in show dogs is 80%. It's amazing. General population, about 60%, and can take us 2 hours to get something that will get 10 minutes with a show dog, because they're just not used to being crated, okay? So we were very, very lucky that we started off in the show ring, okay? Now when we do that, we get these really nice flow traces. This is inspiration, this is expiration, this is time, okay? So these are flow values or flow volumes here against time. And this is what we're looking for, okay? So this is a nice inspiration, and a nice expiration, okay? So that's a typical beagle trace. These are our completely unaffected Frenchies, okay? So these are our grade 0 Frenchies. This is a pretty good trace, okay? So it's got a really nice inspiration. It's slightly flattened on some of its expiration, but I look at this trace and I think this is great, okay? This dog is not really obstructed, okay? And then you've got these kind of traces. This is a fixed obstruction here. So this is more likely to be nasal obstruction, and then this is a dynamic obstruction here, and there's something causing a block at the beginning of expiration, and that's usually the palate, but it can be nostrils, okay? And this is a dynamic obstruction, fixed obstruction. For years, we were looking at these traces, and I could say that one's obstructed and that one's not, but we couldn't quantify it. And then we got enough data, we went down to the maths department, and with the help of Njøten, we managed to quantify what is an affected dog, which really helps. And we've published this. So we now have a BOAS index, which is from 0 to 100%. And we can say how affected dogs are on this kind of scale, where 90% plus is about to do something awful, and 0, 5% is they are completely unobstructed. Okay, so this is pretty useful for us, and it's very good. So it's a 94% accuracy, which for a diagnostic clinical test is pretty good. We see quite a lot of dogs at Cambridge, and when they come and see us, we give them these kind of plots where we'll put down their respiratory parameters, their breathing parameters, and we give them the likelihood of their dog having the disease, having BOAS. So we have people coming to see us because they're worried about their dogs. We also have breeders coming to see us because they want to know should they be breeding with those dogs, and that's great. Okay. So all this information can be found on the Cambridge website. Okay? So if you search Cambridge and BOAS, this will all come up. So once we had this test, we thought, well, what are we going to do now? Okay, well, let's have a little look initially. So do the brachycephalic dogs have different breathing function from the long-muzzled dogs? Okay, and the answer is yes. Okay, so about 10% of our brachycephalic population that we looked at was grade 0, so absolutely no signs whatsoever of airway disease. Okay, and there was quite a lot of overlap between those dogs and some of the longer-faced dogs. Okay, so there is quite a lot of overlap here. However, generally, the brachycephalic dogs have got lower minute volume, so they're breathing less air per minute, okay? But there's overlap. What about the pugs, French bulldogs, and bulldogs? Well, they're different, okay? So you could easily separate the three breeds, particularly when they were severely affected. So these are our most severely affected dogs here, and these are our control dogs here. So these have got no disease, okay? And you can see, one thing interestingly here is that when they become more affected, what they tend to do is breathe in a more chaotic fashion. Now, this sent us down the wrong track for a while because we were talking to some of the medics and they were kind of modeling us on COPD, which is a pulmonary disease in humans. And people with COPD get very, very constrained in their breathing patterns. They're very restrained. And our dogs do exactly the opposite. Okay? And if you watch a dog that's affected with BOAS, you'll see it. So they'll breathe slowly for a while, and then they'll start doing some gasping or bigger breaths, and they are very, very variable in their respiratory rate. Okay? So that's what we see with our grade 3s. And we've got nice grade 0s and affected dogs for all the different breeds that we've been looking at. So once we've got this, we could look at the proportions of affected dogs in our populations. These are the show dogs, okay? So the red ones are the show dogs. And what we found was that pugs, about 60% were affected. The Frenchies, about half of them were affected, and the bulldogs a little bit lower, okay? So that's where we were when we started. And this has all been published. Now, the second thing we looked at was the nostrils. So do nostrils matter? Well, yes, they do, okay? So these are the ones we said were acceptable. Okay, so we're open here. This is nice. This is mild because there's still a gap. Moderate here, you've got no gap dorsally, and severe, completely closed, okay? And if you look at that, it is really important, particularly in the French bulldogs, where nearly all the affected dogs have got stenotic nostrils, okay? Now, annoyingly, there is a population of French bulldogs in the Midlands, in the UK, who've got the worst nostrils possible, and they're amazing dogs, okay? So what we are not saying is that the stenotic nostrils are causative, okay? What we're saying is there is an association between the two, but it may not be just the nostrils, and it may be that some dogs that have nostrils have got other things going on as well. So this is not saying it's causative, it's saying it's the most strong associative factor that we have, okay? I just want to make that clear, because everyone keeps saying, I don't know if it may be, but I don't know that, okay? And we have not proved that. And then we looked at weight, okay? So we thought that the fatter pugs in particular had a greater risk of developing BOAS, okay? Now, this was a very delicate subject in the show ring. And I kept saying to people, your dog's fat, and they kept telling me, well, the judges have just said it's too thin, and they were, okay? And this was a slight problem for us. And they'd like to go off body weights, and body weights are not accurate because the pug body sizes are changing a bit. So you really can't just go off body weights, okay? So this is the WSAVA body condition score chart. And for us, we didn't find it that useful with the pugs because the pugs often hold their weight around their neck. And they've also got all these wrinkles, okay? So this is our one that we came up with the breeders, and they're happy with this, okay? And what we've done with this, we've photoshopped some. They brought loads of the dogs in, and we photoshopped them. And we are now at the stage to us, if it's got body condition score 7 or over, it's more likely to be affected by BOAS. They are saying now that 6 and 7 are okay for the ring, but they don't want 8s and 9s. Well, that's a big step forward, okay? I personally would like them all to be 4 and 5s, but I'm not going to win that one yet. But we're moving, okay? And that's what you've got to do. You've got to move, okay? So 8s and 9s are no longer desirable. They still think 7's okay. We don't, but, you know, we're moving. And this is why we managed to do this, because if you look at it, BOAS is really important for the pugs, okay? So it's the pugs that we're worried about here. Now, interestingly, the Frenchies and the bulldogs are not that affected by weight. And I think this is because, A, if a Frenchie is really bad, it's going to start regurgitating. Okay, so the really, really bad French bulldogs will regurgitate constantly, and actually they're usually in a very slim body condition score. Okay. The other thing is, if we talk about the trachea in the French bulldog and the bulldog is fixed and it's round. Okay, so you put weight on that, it doesn't make a massive difference. The trachea in the pug is soft, and it's got quite a marked membrane at the top. So if you put weight onto a pug neck, it makes a big difference. You can directly compress that trachea or windpipe, okay? So the pug is different, and that's reflected in these results. So at this stage, I started thinking, well, actually, you know, our box is super, and our box is super. I've got 3 boxes now. I'm really spoilt. But actually, the box takes about an hour to an hour and a half, okay? And it is not easy, and it is certainly not something a general practitioner would find it easy to incorporate in their practice, right? So how did we train the box? Well, we trained the box on listening to airway noises, and that is much easier, and that's something that we can do in 10-15 minutes, and we can train all the vets to do that, okay? So then we thought, well, let's come back and look at this functional grading system. So when we designed this functional grading system, we used, it's not really a tolerance test, we used an exercise stress test. What we do with the guys is we listen to them very quietly, and then we trot them. It's about 4 miles per hour, depending on which dog you've got. Some go faster. Some of the big bulldogs, you do a fast walk, because that's all they'll do, right? That's okay. And what we're trying to do is just stress the upper airway. We're trying to make them take as much air in as we can, so we can spot any airway disease, okay? And it's easy to do, and we do seem to get some quite nice results with it. Now, when we started off the grading system, what we said is that 0 is obviously unaffected, but we also put grade 1 as unaffected. So grade 1 dogs have got mild respiratory noise, but you can only hear it with a stethoscope, okay? So yes, you can hear some noise with a stethoscope, but their exercise tolerance is absolutely fine, and it does not seem to affect their quality of life, okay? Now, the grade 2 dogs have got pretty much usually constant noise that you can hear without a stethoscope. And the grade 3 dogs have got constant noise, but they've also got respiratory effort. So if you look at their body, you can see them puffing. You can see the abdominal muscles going, okay? Now, why did we do this? We did this because in the UK, the populations were such that if you'd have said you cannot say 1s are okay, then we had nowhere to go, okay? So if you want to try and improve the breeds, then you have to be able to give the breeders something to aim for, and the 1s had to be in there. And many of the 1s seem to be pretty stable. So, you know, I thought starting off like this was reasonable, really. And what we're aiming to do, actually, is just get rid of the 3s initially. So this is what we are basing our grading on. So these are the things we're listening for. This is stertor. That's your typical bulldog, okay? That's a palate noise. It's a low-pitch noise. This is stridor. much higher pitched, okay? And if you're listening to the dog, you'll hear that noise most loudly right over the voice box, okay? So much higher pitched, almost like it's soaring, okay? So that's stridor. It's very different to stertor. Now, some of the Frenchies will throw in nasal stertor, which is annoying, right? So that is stertor, but it's on the nose, and you can hear it when you're listening to them. You also occasionally get nasal stridor where they're whistling through the nostrils, but again, you can pick it up when you listen to them, okay? But those are the noises we're actually after. I get a bit scared when they all play. Now, it is important how you listen to these dogs, so you want minimal handling, okay? So you're trying to restrain them, not excessively, and then you're listening from the side of the throat, okay? If you push up on a dog's throat, you're going to make pretty much every brachycephalic have noise, okay? So you've got to listen from the side in a very gentle manner. And then we exercise them or trot them, and then we come back and listen again. Now, this is why we do the exercise test. That's nasal stridor, so that's sucking in through the nostrils. But that's really not bad. Okay? From this, I'm almost going to say that's a grade 1. Okay? So very, very mild disease. 3 minutes walking. "30 minutes later when she's asleep." Okay? Now this dog is not normal. Okay? And this isn't because we've stressed her excessively. I can do this to my cross dog, and he doesn't do anything, right? So this dog has got disease that you don't see unless you put some stress on it, okay? So this is not because we're doing anything excessive. This is us trying to work out if the dog has disease, and it does, okay? Now, we wanted to have a look at if the exercise test that we were using, which was a trot, was better than a walk, because lots of people were using a walk. Unfortunately, I think a lot of us started doing this at the same time, so we were kind of working on our data set and then popped our heads up and thought, oh, okay, different people are doing different things, which is not easy. So the good news is that both using a walk or using a trot is better than doing nothing, okay? So if you want to increase your sensitivity of diagnosis, i.e. if you want to pick up if the dogs are truly affected, you are better doing a walk or a trot, okay? Now, if you put the walk against the trot, you're going to come up with more dogs that are affected if you trot them rather than walk them, okay? So the sensitivity of diagnosis is better using a 3-minute trot than it is using a 5-minute walk, okay? So if you really want to know if your dogs are affected, then that's probably the way to do it. Now, the other thing is we have been talking for years about stridor being laryngeal disease. And then I suddenly thought, whoops, we haven't proven this, and we haven't even checked it. So then what we did is we checked whether stridor was truly laryngeal, okay? And this is, again, is what we're talking about stridor. So it's that higher pitch noise. And if you have that higher pitch noise, those dogs do have laryngeal collapse, okay? Whether it's a grade 1, 2, or 3, so whether it's just the saccules or whether the cartilages are starting to deform. Now, unfortunately, what you can't say is that if the dog doesn't have that disease, it doesn't have that noise, it doesn't have laryngeal disease, because the sensitivity is not as good as the specificity. So it will pick up all the affected dogs if it has a noise there. But if it doesn't have the noise, some of those dogs may still have laryngeal disease, okay? Now, what it does tell you, if you hear a dog with that noise, then you are far more likely to have a serious problem, okay? So at least it gives you an idea which are your more serious cases. Now, we have published this, and we have also put it on our website, and our grading forms are all on our website. One of your lovely Norwegian vets has translated it into Norwegian for us, okay? So I've even got a Norwegian copy of it now, which is very nice, okay? And with this, there is also criteria that very clearly, we hope, specify to the vets what they are looking for, okay? So grade 1, grade 2, what we expect to see in each category, okay? Now, we have made the grading system a little bit different for the pugs and for the Frenchies and the bulldogs, and this is because that laryngeal dynamic collapse that we see in the pugs is sometimes there if dogs get very excited. So in pugs, we are allowing mild stridor as grade 1, okay? So mild stridor that you can only hear with a stethoscope is okay as a grade 1 because those dogs are reading nice and low in the box, and it's partly because they're really excited, but when they go back to normal, they're okay. Stridor in a French bulldog or a bulldog is not acceptable because those laryngeal the larynx has started to collapse in those dogs. Now, We also see some Frenchies in particular that will have intermittent nasal snorting or noise, which we're also allowing as grade 1s because it doesn't seem to affect them particularly as far as the box goes, and we see it so frequently. So intermittent nasal snorting is allowed for a French Bulldog and still can be a grade 1. Okay, so we've tweaked it a little bit depending on the breed. Now, having done this functional grading system, we've also looked at conformational factors, and can we say anything about the phenotypes? So what do the dogs need to look like to have less disease? Well, we can say a little bit. So in the Bulldogs, what we tend to like is we like the dogs that have got a thinner neck. Okay, so it's a thinner neck, and it's also, we're going away from the round-headed Bulldogs, and we like the oblong-shaped Bulldogs, which to us is a traditional old head shape in the UK. Okay, so the oblong brick shape is better than the big round shape that seems to be coming in quite popularly. Also in the Bulldog, we can say that the male is more affected than the female. Okay, we see that throughout the breeding dogs and the pet dogs. Okay, and again, the first thing that's most important in the Bulldogs is the nostrils. So in all these 3 breeds, if you want to try and improve the breeds, then focus on the nostrils initially. Now, what about the pugs? So in the pugs, it's weight. Okay, so we don't like the barrel-shaped pugs. Again, nostrils top of the list. And then there's a couple of other things that came up with the pugs. So the wider the distance between the eyes, the worse the BOAS. So we like this, okay? We like the eyes pointing forward. And we occasionally see dogs that have got really wide set eyes, and that's not great if you want to avoid BOAS, okay? And I don't know why that's coming up, but a couple of the things that we've spotted in the genetics is that the pug seems to have a mid-facial malformation that we sometimes see in the humans. And if you see that malformation in the humans, they have very wide set eyes. Okay, you think, oh, okay, starting to tie together. Again, the wider and shorter skull is not a great thing. And I think so. We haven't linked that yet. Yeah. And in pugs, it's the females that are more affected than the males, again, because they tend to be a bit smaller. Okay, so if you've got compressible tissues and you put more weight on them, the smaller the frame, the worse it is. Okay, so Bulldogs and Frenchies, it's the males, and the pugs, it's the females. What about the Frenchies? The Frenchies we are struggling a little bit with because they like them cobby. And I like them lean. Okay, so we're working on this, right? So we like the Frenchies have got the long necks. Okay, we like them to have a long neck. The thicker and shorter neck is definitely a bad sign. Again, the wider skull. In Frenchies, actually, the muzzle did come up. So it's better to have a longer muzzle in a French Bulldog than a shorter muzzle. And again, the males. And again, top of that list is the nostrils. Okay, so little things we can look at. Now, just to go back to that muzzle. Thank you. So in the 3 breeds, it was significant in the French Bulldog, but it was not strongly significant. So this is the French Bulldog. In the pugs, it didn't really do anything increasing the length of the nose, and the same thing in the Bulldog. Now, in the pugs, we think it's because we don't have sufficient variation amongst our pugs as far as length of nose. Okay. The other thing is with this measurement, so this snout measurement here, is that we were not reproducible with it. So there were 3 of us that measured hundreds of these dogs, and our variability in those measurements was 60 to 70%, i.e. it wasn't worth doing, right? So for us, we cannot measure this, even though we're very used to doing it in an accurate manner. Now, the reason we can get away with the neck girth and the ratio is because you tend to measure things systematically wrong. So if you do a slightly larger neck, you tend to do the same thing on the chest, okay, if that makes sense. So that was our best measurement, was the neck girth ratio compared to the chest. And that was something that we were quite good at. But this one we found very difficult. I don't know how many of you guys have tried this, but if you come at pugs with a tape measure, right, I mean, it's really hard, right? So it is not easy to do. Now, the other thing we want to say about this is just remember that if you want to increase that craniofacial ratio, there's 2 things you can do. One thing you can do is make this bit longer, which has got the nostrils in it. The other thing you could do is you could actually make the skull shorter, right? And if you make that skull shorter, it is the worst possible thing you can do, right? So if you want to improve this, you can, yes, certainly increase the size or the length of that nose, but please also increase the length of the head, okay? It's not all about the nose, it's about the head, okay? The nasal cavity is underneath the cranial bones, so it's underneath here, right? It's not in this bit, it's under here, okay? So we've turned our functional grading scheme into breeding guidelines for our breeders, and this is what we've said, okay? I wonder if I can go back one. So we've said the grade 3s are out, okay? So any dog that has got obvious respiratory dyspnea or effort after 3 minutes of exercise should not be bred from, okay? And I don't care whose sire he is and how much he was worth at Crufts 2 years ago, just say no. Ooh. So if he's got the grade 3s have got severe noise, okay? So you can hear them constantly, but they've also got effort. So their chest will be going and their abdominal muscles will be going, and if they've got that, you don't breed from them, okay? They're out, okay? For us, that's about 15% of our breeds usually, okay? So 15% of the breeds we're saying don't breed from them. Now, obviously the grade 1s and the grade 0s are a complete green, okay? The grade 2s we have not taken out yet, and the reason we've not taken out the grade 2s is because we are focusing on one disease, right? Just BOAS. If you chop down the gene pool too fast, then we are likely to push up other diseases, okay? And the people we're struggling a little bit with this is the bulldogs. So the bulldogs have taken this on board so well, but now they're running too fast, okay? So they don't want to breed any of their grade 2s anymore, and that's not the way to do it. And I keep saying this, and I will keep saying this, leave the grade 2s in, but cleverly breed your grade 2s, right? So if you've got a grade 2 dog, breed it with a grade 0, right, or a grade 1. The grade 2 to grade 2s probably should be avoided, okay? But if you take the grade 2s out too fast, then the chance of something else coming up is relatively high, okay? Because you're going to get a bottleneck.
Well, I was thinking, when you use a grade 2 with a grade 0, what about the insurance on someone?
As in the insurance on the grade 3s.
Yeah, are they aware of this?
They haven't picked this up yet. They will do. Yeah. So at the moment, we are just saying take the grade 3s out, okay? Now, the other thing is this is polygenic, okay? So there are multiple genomic areas that contribute to BOAS, okay? So unfortunately, we're going to have dogs where the breeders have bred a grade 1 and a grade 0, and you get the occasional grade 3. It's going to happen, okay? We know this, right? It hasn't happened to me yet, but it will happen, and people will come up and you think, yeah. And I've got some great breeders who are really following this, and they occasionally get dogs that are not perfect, okay? And I think I'm really sorry, but actually, you're going to do so much better than if you're breeding grade 3s, right? So even if you still get the occasional grade 2 or 3s coming out, it's going to be far less than if you're breeding your grade 3s, okay? But this is a complex disease, and we're not going to be able to completely sort it out instantly by doing this kind of thing. We'll help, but it's going to take time, okay? Now what I'm hoping is in 10, 15 years' time, we can come back and we can split the grade 2s, and then maybe we take out more grade 2s then, okay? But we have to do it in a gradual process. So we launched this year, and we have currently launched it for the pugs, the French bulldogs, and the bulldogs. And the biggest thing I have at the moment is everybody else trying to get in on there. So Bostons are coming after us and Peaks, which is great, right? But we just need a little bit more time, and then we'll try and sort those breeds out. But to me, the Frenchies, the bulldogs, and the pugs have got by far the worst disease, and we have the most prevalence in those breeds, okay? So that's why we started there. Now, will it work? This is my typical grade 2 Frenchie. My phone, sorry, it's not the best video. So that Frenchie's had her palate done, okay? So she's had her palate done, and she's still got quite marked obstruction. It's nasal, okay? So we know this can happen now, and because we're better at recognizing these signs, when people bring the dogs in, we'll say, well, this probably will help, but your dog's got quite a lot of nasal obstruction, so we might have to come back and address that later on, or you might find there's still noise there, okay? So at least we can start to tell people now what they're likely to get afterwards. This is her daughter. Now, the breeders hate this dog because she's got a really long neck, and she's the wrong color, and look at her ears, right? So I know that she's never going to win in a show. But the reason she's licking her lips is because I'm holding a ball, right? So this is what she wants. She was like a gazelle, okay? She's beautiful, absolutely beautiful. There's absolutely no noise on this dog at all, okay? She's 3 years old now, and she goes like a whippet, right? So you can do it, okay? Now, I accept it's maybe not the most aesthetically pleasing Frenchie, but she's great, you know? So you think, okay. Now, what else can we do to improve the breeds? Well, there's a few other things we need to look at, and one thing we can try is to decrease the brachycephalic population, okay? Now, we're finding this really difficult in the UK, and a lot of this is down to social media, unfortunately. So we are trying to discourage advertising, and what we have managed to do with the Brachycephalic Working Group is sort out a system where if any companies, particularly the high-profile companies, are advertising using brachycephalic dogs, we are asking them to change or asking them why they are using those dogs. And that is good, and it's helpful, but you cannot get away from the social media where the French is particular or over everything, okay? So it's helpful, but it's not the answer. We are trying to educate the public. So we had a Disney film out last year called Patrick the Pug that absolutely bombed. And we did put out health leaflets. Disney were great, so they didn't put any merchandise out with that film. They were really good. So after we talked to them, they took away the merchandise. And they also put out health warnings at the bottom of the film saying not all pugs are healthy, and we gave leaflets out at the cinema. So, you know, that kind of thing does help, okay? What about discouraging ownership? That's really difficult. So we find that many people that have had a brachycephalic dog, extreme brachycephalic, if anything happens to it, they'll go back and get another one, okay? Even if they've had all the problems we described. And actually, although I don't approve of that, they are very nice dogs, some of these guys. They've got lovely temperaments, and I can totally understand why people like them, if I'm being honest, okay? So I think, unfortunately, once people go down a breed and they get very attached to them, it's very, very normal for them to go and repeat the breed when they choose their next dog, okay? We are publicising the costs associated with ownership. I have talked to insurance companies and said, are you sure you want to cover these dogs for insurance? Because if you take away the insurance, that's one way to cut down the dogs, okay? Which was a bit naughty of me, but I thought, well, it might work. The insurance companies do not want to get rid of the brachycephalic dogs because the premiums they put on these dogs are immense, okay? So in London, for a brachycephalic dog, you can easily be looking at £150 to £200 a month, okay? Insurance premium, okay? So for them, they are very happy to take the hit of the occasional surgery and continue to look after the brachycephalics, okay? So unfortunately, there isn't a way forward with the insurance companies. So that leaves us really with trying to improve the dogs that are out there, okay? So what you then have to do is try and get people to use good dogs and make sure that they don't think that buying dogs over Gumtree is acceptable, which unfortunately a lot of the UK population is doing at the moment, okay? So it's trying to teach the public, if they want these dogs, to go and get a good one. And we have some really good breeders out there, so you can find good dogs. Now, we also have some welfare campaigners, Cruffer. So these guys are the campaign for the responsible responsible use of flat-faced animals, and this is one that they picked up on. They absolutely love this. So here's the American Kennel Club with a pug on that. You think, you don't want to do that. You don't want to do that. So that one got hit straight away. And they try and hit some of the social media people that have their little brackies all over the place. And actually, these guys are very reasonable in the UK now. So they're actually not as vicious as they used to be, and I think they're much happier now that we are working progressively on this problem. So actually, we've just done this International Canine Dog Health Workshop, and we had people from Cruffer in the same room as the Kennel Club, and it was fine, because actually you've got to bring people together, okay? And having, these people are actually really bothered about the welfare of dogs, and if they can see you trying to help and actually see that you're coming up with a plan, they're usually easier to work with. So for us, it's actually getting better. But we haven't got over this kind of thing. So this guy, I think he's called Cooper, has about 25,000 followers on Facebook. Well, what do we do about this, So they dress him up and they do anything, But at the moment, we are struggling to combat this kind of thing. So what do we do? So we're trying to improve the health of current dogs. So the most important thing is to look for the approved breeders or know how to choose a decent dog, okay? Look for parents that are health tested. Now, you don't often get the father, but you can look at the mother, so actually encourage people to go out there, look at the setting, look at the dogs, okay? We need to increase the awareness of the signs of disease, and then when people get the dogs, they've got to control the weight, and they also need to exercise them. So we're constantly told that these dogs don't require exercise. Well, that's rubbish, and we have pugs that do agility, and they're great, okay? So if you want to keep these dogs healthy, then you want to keep them in nice muscle condition, So I get really cross when we have a lot of city dwellers that buy these dogs and then don't walk them at all, and that's just wrong, okay? So these dogs do need exercise. Now, what else can we do? Well, there is a breed standard. okay? And this breed standard is currently being reviewed. So for the last 2 years in the UK, we've been working on the breed standard. It's been going back and forwards between the Brachycephalic Working Group, the health clubs, and the Kennel Club, because it takes an awful lot of discussion to get this kind of stuff sorted out, okay? Now, I have to say, I am not too bothered about the breed standards, because to me, the current breed standard is not terrible, okay? And actually, it's a way that it is looked at in the ring. So the power in the UK is with the judges, okay? And you could use our current breed standards in a totally reasonable way and move away from the extreme dogs, okay? So although I don't mind them looking at the breed standard, it's got to be good because that's what everybody else looks at, and Crawford will talk about breed standards, but it doesn't mean a thing unless the judges are on board. So that's where we're trying to push now. We're trying to get judges that actually, if they put dogs up that have got severely stenotic nostrils, will be noticed, okay? And in the best people to talk to about this are the other people in the breed, okay? And they will tell you. They'll say, look who won Cross 2 years ago, and they'll get the picture out, and they will have really bad nostrils. So the best people to talk to are the other people in the breed who know exactly what's happening, okay? And the judge is an issue at the moment, I think. So we are working with the Kennel Club. So we've got health and breed information. We've got the Brachycephalic Working Party, which I think is useful. The Kennel Club have produced lots of puppy packs, which are good, okay? And they've also put out publicity. They put it up on their website. They put our site up on their website as well. And they do discourage advertising. So there is a bit of a movement now in the UK to try and get this under control. We do have vet checks at the shows. Now, I struggle with those as well because the vet checks aren't allowed to use anything veterinary, okay? So you're not allowed to use a stethoscope because that's an extra tool that the judge doesn't have. So your vet check really is just checking that the judge hasn't missed anything, okay? And I think if it's a vet check, why not make it a vet check, you know? So that's a bit where, but you've got to move slowly, okay? So that'll be my next little nudge, but we're doing that. We have a problem with our vets. Our vets do not report the surgeries, okay? I report surgeries, but many vets do not report surgeries. And some of this is financial. So if you have a lot of breeders using a certain vet and that vet feels that he will not be able to continue to have those breeders if he reports the surgeries, then unfortunately they don't do it, okay? So there has to be a stand taken by the veterinary profession as well that says we're all going to report surgeries, okay? And if they all report their surgeries, then this will become less of an issue, okay? But at the moment it does not happen, okay? So that's a problem for the veterinary profession. The respiratory function grading scheme, I think, is a nice step in the right direction. We have a lot of breeders that are on board, and that's very helpful. And then the Kennel Club is also funding, so it funds Vet Compass, which is an epidemiological study at London that looks at all the primary practices and sees what are coming in as far as diseases. And then it funds us, and we do quite a lot of work on confirmation and also diagnosis and recognition. And then we've got a little bit more stuff going on as well. So we've got, they've come up with these breed health plans as well that have now got on their website. At the moment, we've still got pugs and bulldogs as category 3 high-profile breeds, and the French bulldog is a category 2. Now, I think the bulldogs should be categories 2 as well now, because they really have done a lot with their breed, okay? And the shows that I used to go to 10 years ago are completely different to the shows I go to now. So if I had to pick one of our 3 breeds that's making a big difference, it's actually the bulldogs, okay? The pugs fought amongst themselves for about 10 years, and now they're all together, okay? But that's what happens with pugs in the UK. And the French is, the French has got a lot of dogs coming in. It's difficult. We've also got the Dog Wellnet website, which is useful, and it talks about all different kinds of disease on there, and it also gives you information on the international working groups, which is helpful. Now, the Brachycephalic Working Party is, I think, very helpful as well. So on here, we've got the breed councils. So we've got usually the presidents and the health secretaries of the breed clubs. We've got the veterinary profession. We've got somebody from the Kennel Club. We've got the dog rescue charities, and we've got the researchers. And it's actually quite nice because what you realize is that you cannot enforce things onto dog health clubs because they've got to go and check everything through their population. So it's no good just saying we're going to do this. It's got to come from the ground and come up, okay? So actually what it does is it gives us a way to talk to all of the people that are involved, and actually just imposing instructions doesn't work. It's got to come from the membership for things to really be taken on board. So I think that has been very useful. And this I think we've mentioned. So what do we need to work on now? Well, I think the judging is still a problem, okay? And I don't know what it's like in Norway, but many of our judges judge their own breed, which means that they are actively judging dogs that they have had some input in breeding into, or they know exactly where they've come from, or they are friends. So I'm probably going to get shot in a minute. But I think I think the judging is an area that we could improve. I think we need to review dog shows, so I think we need a little bit more fun, and we need some more. So some of the most popular days in the UK are nothing to do with the best of show. They're just fun days, okay? So maybe we could take a step back from it always being about best of breed and be a little bit more about, let's just have a French Bulldog Day where we bring dogs and does it always have to be about who's the best? I mean, I guess maybe it does because it's a money industry, but it would be nice to have some alternatives to just best of show, I think, okay? We would like to see functional testing prior to shows. I think chucking dogs out at a show is very, very difficult for a vet to do, okay? Such stress on you and such a kind of a view on you that it makes it very difficult. I think if you had it that no grade 3s were allowed to enter shows, that would be great, okay? So why don't we just do it before the show, particularly for the higher shows? What about for crufts? As part of your cruft mentorship, if you're a brachy dog, you've got to assign the fact you've had a BOAS test and you're not a grade 3. No? I think it's great. I would too, but I do, okay? And again, I think if you're going to breed and advertise stud dogs, then maybe you should have to do your functional testing, okay? And again, publicity. Now, the veterinary organisations, the BVA and the BSAVA, have also been coming out quite vocally in the UK. And they are now talking about everybody working together, which I think, again, is important, okay? We're not talking about one group being more important than the other, okay? So it's the vets working with the kennel club, with the breeders, with the public to try and improve this situation, okay? Now, I'm not sure about this, okay? Using scientific evidence and data now readily available, okay? And I think, really? So a lot of the stuff they're talking about is mine, and I think, well, we've done quite a lot, but there's an awful lot we haven't done, okay? So there is some evidence, okay, but we still don't have a huge amount of evidence, particularly for some of the other breeds, okay? So we'll use what we got, but it isn't like there's huge amounts of evidence now, if I'm being honest, okay? And again, they've gone for the revised breed standards, which fine, I mean, that's the kind of thing that gets publicity. I don't think it's the most important, but that's what they're going for, okay? And this is just our craniofacial ratios again, so if they're all shouting about increasing the length of the nose, most of our dogs are in this kind of area here, and it really doesn't seem to make a huge difference. Now, okay, if you're really short, it's not great, and if you're really long, it might be better, but the majority of our dogs are sitting here, okay? And it won't make a massive difference. Now, what else can we do? So, there is evidence for a genetic component to BOAS, okay? So we do know that the short-faced dogs have obviously got more of this disease, and that we can get lines in particular breeds that are affected or non-affected, okay? So we have some really good, I can spot the breeders and I know which dogs they've got, and they'll have some really nice dogs, so you can see the lines of dogs that are better, and they obviously often look very similar, okay? So there is a genetic component. So how do we find the genes that cause the inherited disease? Well, the first thing you've got to be able to do is you've got to have a clear phenotype. So you've got to be able to define the control dogs from the affected dogs. So that's what we've tried to do with the respiratory function grading, okay? So at least now we can say these are the good dogs and these are the bad dogs, okay? And then we're looking for polymorphisms that segregate with disease. So which of our SNPs or our areas in the genome are coming out with the control dogs and which are in the affected dogs. Now, there's different ways we've been doing this. So we've been looking at some GWAS, so genome-wide associative studies. We've also looked at Manhattan plots, which is where you're looking for the actual single nucleopeptides. And it's actually looking pretty promising, okay? So there are a few areas of the genome which are fixed, okay? And we know that. So particularly when it comes to head shape, there are some areas which are homozygous, so it means that both the genes have been deleted or they're both the same, which means you've got very little variation in your population and you therefore cannot alter it. Now, we know with the BOAS dogs that it's not all about that, because actually we've got a lot of variation in our BOAS grades, okay? So yes, there are some areas that are fixed, but there is also some variables in our areas, okay? And we've got fixed areas, yeah, but we've also got loci that we can look at. So we looked at quite a few with Manhattan plots. And this is just a body weight one in French Bulldogs, and we can see some nice peaks here. But this is one of our BOAS ones in pugs, okay? And we haven't got amazing peaks, but we do have some nice peaks. And then if you look at it according to grade, you can see it's segregating quite nicely. So what we've got at the moment is we've got about 4 or 5 loci in different breeds. And interestingly, they don't overlap that much. So the pugs are different to the French bulldogs. There's a little bit of overlap between the French bulldogs and the bulldogs, which makes sense, okay? Because if you look at the lineages, that does follow, okay? So we can see that we've got some quite nice snips coming out. And this does give us hope that we'll be able to get at least some estimated breeding values in the next 2 to 3 years, okay? And a lot of these snips are coming out with areas that are chondrodysplastic. And this is one we were talking about in pug. You've got a snip on a chromosome that looks very similar to some of the midfacial malformations in humans. And some of this is quite interesting. So the pugs get this nasal septal deviation. You don't see it in the French to the bulldogs, but you see it in the pugs, and it looks like it's this kind of thing coming on, okay? So maybe then we can even use the pug as a way to model some of these human diseases, which is quite nice, okay? So what do we think about the genetics at the moment? Well, we think it's about 35 to 40% of the variation in the BOAS, okay? So it doesn't account for all of it, certainly. However, we are certainly working on the idea that we can do genetic testing. We probably won't be able to get down to grades. It's probably going to be affected and non-affected. And we initially did the GWAS, but now we're on a field study. So now we've sent out swabs to the population again, and we're trying to work out if the SNPs that we've picked up are actually in the whole population. And if they are, then we can move forward, okay? And probably the first thing we're going to try and do is come up with an estimated breeding value, okay? So that will be used by the breeders, and hopefully will take us a little bit further forward than the respiratory grading scheme. What we're trying